ingredient supplier, I think I'm at a very unique vantage point because I am able to control the extracts and the extractors that I work with for the natural products that I am developing, and also be able to pass on the right science to a brand. So, and I think for me, when I look at scientific rigor, quality, integrity, I really can't separate the three. So I want to be able to go into each one individually. So what like Nutriventia would do is right from selecting the extractor, doing our vendor qualification, understanding, the raw material, testing it batch to batch, auditing our vendors on a regular basis. That forms a part of the crux of how we start any product development. Let's take it a step further and then look at the formulation. So when we have selected an ingredient, what is the active content? Is it standardized? Is it standardized to the US pharmacopoeia? What am I looking for in terms of delivery technology? So what are the inherent handicaps in the ingredient which make them either inaccessible, large doses, very short half-life, multiple doses? So what is it that Nutriventia can bring to the table? And that's how then our development process starts. Once we have an idea of which delivery technology to use, we then take it a step further and try to understand, okay, what's the mechanism of action? What are my natural dietary-based excipients that I can use to enhance the product? Because I don't want to take a natural product and add synthetic surfactants or artificial excipients to it. So that forms then the basis of developing the product. Take it another step further, understanding what is my preclinical requirement, what is my dosage. When you're looking at dosage, it's not a straightforward answer. We start with preclinicals were required. We will do pharmacokinetic studies, and these pharmacokinetic studies are actually not as popular in our industry, but they give us a very important insight to say if this is the dose, what is available in the plasma in humans. Then we build on top of that, where we take then the dose that is in the pharmacokinetic study and we do our clinical efficacy at that same dose. So if I'm telling you it's a 250 milligram product, I have tested that 250 milligrams pharmacokinetically to see what's the availability in plasma, how bioavailable is it, and then move that further to the clinical efficacy studies, which will be done at that exact same dose, not at a higher dose, because it's not about getting you're not going to get some extra fantastic results. You could assure yourself of results, but you'd rather start at the dose that you think makes sense. So I think for us, all of these different steps, and when you think about integrity, you would take that another step further, because you would take your clinical research and then get it published in peer-reviewed journals. So this is not just what you're saying, you're getting the larger scientific community to agree with your findings. So for me, it's difficult to look at scientific rigor kind of separately, but when you look at quality, right from your selection to all the things that you subject your raw material and your finished product to, look at safety, look at toxicity, look at what is my active content batch to batch. I think that's what puts together the entire process and brings that scientific rigor to our product development cycle and brings all three pieces of the puzzle, quality, integrity, and scientific rigor, properly together.